Polycystic kidney disease, ever heard of that? Growing up as kids, most of us wanted superpowers. Even now as adults, a good percentage of adults secretly want superpowers. I mean, won't it be nice to have? The funny thing yet unfortunate is that we think we need to be mutated to get superpowers, especially after watching Spider-Man or X-Men. Well, wake up, in real world mutation can kill you or give you a disease that will cause you pain all your life. A good example is polycystic kidney disease. Do you know what is unfortunate about gene mutation and hereditary diseases? There is mostly no cure. You have to properly manage the disease to live a long life. That is why I'm going to use this video to educate you and shed light on this not so popular disease. This video is different from my other videos as I decided to take a different approach to address questions that most people have. In other words, this video is an FAQ to polycystic kidney disease. So, watch this video to the end. Your question might be answered, and at the end, please do not forget to like the video and consider subscribing to the channel for more informative videos like this. Hi, if you are new to my channel, I am V and welcome to the best health channel on YouTube where we talk about everything related to your health and well-being. The first question I know most of you have is, what is polycystic kidney disease, PKD? Polycystic kidney disease is a genetic disorder characterized by the growth of numerous cysts in the kidneys. These cysts are filled with fluid and can lead to the kidneys becoming enlarged. Over time, the presence and expansion of these cysts can damage kidney tissue and impair the kidney's ability to function properly. Cystic kidney disease versus polycystic kidney. You might be asking, what is the difference between cystic kidney disease and polycystic kidney disease? Well, their difference is based mainly on their causes. While cystic kidney disease can be acquired from different other kidney diseases, polycystic kidney disease is a type of cystic kidney disease that is solely caused by gene mutation and inherited. What causes polycystic kidney disease, PKD? Polycystic kidney disease is primarily a genetic disorder, which means its primary cause is related to mutations in specific genes. There are no external causes, such as lifestyle or environmental factors, that directly cause PKD. However, when discussing the causes of PKD, we're typically referring to the genetic mutations responsible for the disease. For clarity, I'll explain the genetic basis and related factors associated with the development of PKD, keeping in mind that the term causes, in the context of PKD, mainly pertains to its genetic origins. Pathogenesis of polycystic kidney disease. Mutation in the PKD1 gene. This is the most common genetic cause of autosomal dominant polycystic kidney disease, ADPKD. The PKD1 gene, located on chromosome 16, accounts for about 85% of the cases. Mutations in this gene lead to the development of numerous cysts in the kidneys. Mutation in the PKHD1 gene. This gene is associated with autosomal recessive polycystic kidney disease, ARPKD. Mutations in the PKHD1 gene, which is located on chromosome 6, cause this form of PKD. ARPKD is less common than ADPKD and often presents more severe symptoms early in life, including kidney dysfunction and complications related to other organs. Genetic inheritance patterns. The autosomal dominant inheritance pattern of ADPKD means that having just one copy of the mutated gene from one affected parent can cause the disease. In contrast, ARPKD follows an autosomal recessive pattern, requiring a child to inherit two copies of the mutated gene, one from each parent, to be affected. De novo mutations. While most cases of PKD are inherited, a small percentage result from de novo mutations. This means the genetic mutation occurs spontaneously in the individual's gene without being inherited from the parents. These cases can then be passed on to the next generation in an autosomal dominant manner for ADPKD. Is PKD hereditary? If so, what is the risk of passing it to my children? I am sure my earlier explanations have answered this question, but I will explain further on the risk and chances of your children getting it or chances of you getting it from your parents. To do that, we will talk about the types of PKD. Are there different types of PKD? Yes, there are two types. Autosomal dominant polycystic kidney disease or ADPKD. This is the more common form and usually develops in adulthood, although symptoms can appear at any age. It's called autosomal dominant because a child needs to inherit only one copy of the mutated gene from one parent to develop the disease. This means that if one parent has ADPKD, there is a 50% chance, or 1 in 2, of passing the gene mutation to each child, regardless of the child's gender. Therefore, the risk of a father passing it to his son, or a mother to any child, son or daughter, is the same, 50%. The next type is autosomal recessive polycystic kidney disease, ARPKD. This form is less common and often more severe, typically presenting itself shortly after birth or during early childhood. It's called autosomal recessive because a child must inherit 2 copies of the mutated gene, one from each parent, to be affected. For a child to have ARPKD, both parents must carry a gene mutation for the disease, and each child has a 25% chance, or 1 in 4, of inheriting the condition. This means that both the mother and father must carry the gene mutation, and in each pregnancy, there is a 25% chance the child will inherit 2 mutated genes, one from each parent, and have ARPKD. 50% chance the child will inherit 1 mutated gene and 1 normal gene, making them a carrier like their parents but typically without symptoms of the disease. 25% chance the child will inherit 2 normal genes, neither developing the disease nor being a carrier. Genetic counseling can provide families with information about the risks of PKD and the likelihood of passing it on to their children, offering guidance on family planning and management of the disease. What are the symptoms of polycystic kidney disease, PKD? Polycystic kidney disease, PKD, leads to a variety of symptoms, which can vary widely in severity and onset among individuals. The growth of cysts in the kidneys, and sometimes in other organs, can lead to a range of complications. Here are the primary symptoms and related complications of PKD. High blood pressure, hypertension. Often the first sign of PKD, high blood pressure can worsen kidney damage if not controlled. It's both a symptom and a cause of further kidney health decline. Pain. People with PKD might experience pain in their back or sides. This pain can be due to the enlargement of the kidneys, cyst growth, or cyst rupture. Blood in the urine, hematuria. The rupture of cysts in the kidneys can lead to blood appearing in the urine. Urinary tract infections, UTIs. Individuals with PKD are at a higher risk of developing UTIs, which can also involve the kidneys, pyelonephritis. Kidney stones. The presence of cysts can disrupt the normal flow of urine, leading to the formation of kidney stones, which can cause pain and lead to infection. Kidney failure. Over time, the growth of cysts can impair kidney function, potentially leading to chronic kidney disease, CKD, and eventually end-stage renal disease, ESRD, requiring dialysis or kidney transplantation. Headaches. Headaches can be a symptom of PKD and might be related to high blood pressure or, in some cases, to the development of aneurysms in the brain. The severity and progression of these symptoms can vary greatly. Some individuals may live a long time without experiencing severe symptoms, while others may encounter significant health challenges related to PKD. Management of PKD focuses on controlling symptoms, treating complications, and slowing the progression of kidney damage. What are the complications associated with polycystic kidney disease? Polycystic kidney disease, PKD, can lead to several complications as the condition progresses, primarily due to the growth of cysts in the kidneys and sometimes in other organs. These complications can significantly impact an individual's health and quality of life. Apart from kidney failure, severe high blood pressure, other complications can be cyst infections. Kidney and liver cysts are susceptible to infections, which can be challenging to treat and may require antibiotics or drainage. Liver cysts. While not as damaging as kidney cysts, liver cysts can grow large, causing discomfort and potentially leading to complications like liver enlargement and, rarely, liver failure. Brain aneurysms. PKD increases the risk of developing aneurysms in the brain. Although they are relatively rare, they can be life-threatening if they rupture, leading to a subarachnoid hemorrhage. Heart valve abnormalities. Some individuals with PKD may experience heart valve problems, such as mitral valve prolapse, which can affect heart function. Pregnancy complications. Diverticular disease. PKD patients are at increased risk for developing diverticula in the colon, leading to complications such as diverticulitis. Managing PKD effectively requires regular monitoring and treatment to address these complications and mitigate their impact on health. Can polycystic kidney disease be prevented? Polycystic kidney disease, PKD, is a genetic condition, and currently, there is no known way to prevent it. The development of PKD is primarily determined by the inheritance of specific gene mutations from parents to children. However, while the onset of the disease cannot be prevented, there are strategies to manage symptoms, slow the progression of the disease, and improve the quality of life for those affected. How is polycystic kidney disease diagnosed? PKD. Diagnosing polycystic kidney disease, PKD, involves a combination of family history, physical examination, and imaging tests. The process aims to identify the presence and extent of kidney cysts and assess kidney function. Here's an overview of the diagnostic approach for PKD. Family medical history. Given the genetic nature of PKD, a detailed family medical history is crucial. This helps identify any patterns of PKD or related symptoms in family members, supporting a preliminary suspicion of the disease. Physical examination. A healthcare provider may detect signs of PKD during a physical examination, such as high blood pressure or an enlarged abdomen due to enlarged kidneys. Palpation of the abdomen may reveal large, polycystic kidneys or liver cysts. Imaging tests. Imaging studies are key in diagnosing PKD, allowing doctors to visualize cysts in the kidneys and sometimes in other organs. Common imaging tests include ultrasound, the most frequently used diagnostic tool for PKD. An ultrasound can detect cysts in the kidneys and is effective in diagnosing the majority of cases. Computerized tomography, CORT, scan. A CT scan provides detailed images of the kidneys and can detect smaller cysts that might not be visible on an ultrasound. It's more sensitive but also more expensive. Magnetic resonance imaging, MRI. MRI can produce detailed images of the kidneys and cysts without using radiation. It's particularly useful for evaluating the severity of PKD and checking for cysts in other organs. Genetic testing. While not routinely performed for all cases, genetic testing can confirm a diagnosis of PKD, especially in uncertain cases or when planning a family. It involves analyzing DNA for mutations in the PKD1 and PKD2 genes, which are responsible for most cases of ADPKD, and the PKHD1 gene associated with ARPKD. Kidney function tests. Blood and urine tests can assess how well the kidneys are filtering waste from the blood. These tests measure levels of creatinine and urea in the blood and check for protein in the urine, which can indicate kidney damage. Screening for complications. Because PKD can lead to various complications, such as high blood pressure and chronic kidney disease, screening for these conditions is an integral part of the diagnostic process. Diagnosing PKD early can help in managing the condition more effectively and monitoring for potential complications. Treatment focuses on managing symptoms, slowing the progression of kidney damage, and maintaining overall health. Can polycystic kidney disease be cured? No, it can't be cured at the moment, but there is a management plan and treatment options that can help manage the symptoms and prolong your life. What are the treatment options for polycystic kidney disease, PKD? While there is no cure for polycystic kidney disease, PKD, treatment focuses on managing symptoms and slowing the progression of the disease to preserve kidney function for as long as possible. Treatment strategies can vary based on the symptoms, complications, and individual health status of the patient. Here are the main approaches to treating PKD. High blood pressure management. Controlling high blood pressure is critical in slowing kidney damage in PKD. This often involves lifestyle changes and medications, such as angiotensin-converting enzyme, ACE, inhibitors or angiotensin II receptor blockers, ARBs, which can help protect the kidneys beyond their blood pressure-lowering effects. Pain management. Pain related to kidney or cyst enlargement can be managed with over-the-counter pain relievers, but it's important to avoid nonsteroidal anti-inflammatory drugs, NSAIDs, as they can worsen kidney function. For severe pain, a doctor may recommend draining large cysts through a procedure called cyst decortication or sclerotherapy. Treatment of urinary tract infections. Antibiotics are used to treat urinary tract infections, UTIs, and kidney infections promptly to prevent further damage to the kidneys. Healthy lifestyle. Maintaining a healthy lifestyle can help manage symptoms and potentially slow disease progression. This includes regular physical activity, a balanced diet, staying hydrated, limiting alcohol and caffeine intake, and not smoking. Monitoring and managing kidney function. Regular checkups with blood and urine tests are essential to monitor kidney health and function. As the disease progresses, treatments may focus on managing chronic kidney disease, CKD, symptoms and complications. Dialysis and kidney transplant. For those whose kidneys fail, end-stage renal disease, dialysis or a kidney transplant becomes necessary. PKD patients are generally good candidates for kidney transplantation. Medications for cyst growth. Tolvaptan, Genarche in the U.S., is a medication approved to slow the progression of kidney damage in adults at risk of rapidly progressing ADPKD. It works by blocking the action of vasopressin, a hormone that promotes cyst growth. Tolvaptan use requires careful monitoring due to its potential liver-related side effects. Genetic counseling. For families affected by PKD, genetic counseling can provide valuable information about the risk of transmission to future generations and discuss reproductive options. Treatment plans for PKD are highly personalized and depend on various factors, including the type of PKD, the presence of symptoms, the rate of disease progression, and the overall health of the individual. It's essential for people with PKD to work closely with their healthcare team to monitor their condition and adjust their treatment plan as needed. How does polycystic kidney disease affect pregnancy? Polycystic kidney disease, PKD, can have specific considerations and potential risks during pregnancy for both the mother and the baby. Generally, women with PKD have successful pregnancies, but they are at an increased risk for certain complications compared to women without PKD. Here's how PKD can affect pregnancy. High blood pressure, hypertension. Women with PKD are more likely to develop hypertension, which can be a concern during pregnancy. Hypertension can increase the risk of preeclampsia, a serious condition characterized by high blood pressure and signs of damage to another organ system, often the liver and kidneys. Preeclampsia typically occurs after the 20th week of pregnancy and can lead to severe complications if not properly managed. Preeclampsia. The risk of developing preeclampsia is higher in women with PKD than in the general population. Preeclampsia can lead to complications such as preterm birth, low birth weight, and, in severe cases, can be life-threatening for both the mother and the baby. Genetic considerations. Since PKD is a genetic disease, there is a possibility of passing the condition on to the child. Women with PKD who are pregnant or planning to become pregnant should consult with a healthcare team that includes a nephrologist, an obstetrician experienced in high-risk pregnancies, and potentially a genetic counselor. What is the prognosis and life expectancy for polycystic kidney disease? The prognosis for individuals with polycystic kidney disease, PKD, can vary widely depending on several factors, including the type of PKD, the onset and severity of symptoms, and how effectively complications are managed. But generally, life expectancy is between 53 to 70 years if managed properly. In conclusion, polycystic kidney disease, PKD, is a genetic disorder characterized by the growth of numerous cysts in the kidneys, which can affect kidney function and lead to various complications. While the prognosis of PKD can vary widely among individuals, advancements in medical research and treatment options continue to improve the quality of life and outcomes for those affected by this condition. Effective management of symptoms and complications, along with regular medical checkups, play a crucial role in navigating PKD. I hope this discussion has provided valuable insights into the complexities of PKD, including its causes, symptoms, diagnosis, and treatment options, as well as the importance of genetic counseling and lifestyle adjustments in managing this condition. Thank you for watching until the end. Your interest and support in spreading awareness about PKD and other kidney diseases are incredibly important. If you found this information helpful, please don't forget to like this video and subscribe to my channel for more health-related content. Your engagement helps me reach and educate a wider audience about conditions like PKD and the latest advancements in healthcare.